Hello everyone. As we head to the last 5 weeks of term, you'll be aware that we're entering the winter period where bugs and germs are more prevalent in our community, and you'll have noticed that the numbers of COVID cases are rising. It's now doubly important that we work together to keep the children safe so that school can remain open. Therefore, I have contacted Public Health England today to discuss our risk assessments and procedures as they currently are, and also procedures should an outbreak occur. As a reminder, an outbreak is considered to have occurred in a special school if there are 2 or more confirmed cases in a class. I felt it would be useful to discuss this with Public Health in advance and also to advise you of the plans in place so that you know what to expect should that situation arise. If there are 2 or more confirmed cases within a class group, that class would become a bubble. They would eat in their classroom, play at a different time to everyone else, and wouldn't be accessing the rest of school facilities as usual. Staff in that class would book a PCR test and take daily lateral flow tests whilst awaiting the results. We would encourage pupils for whom you are able to get them to take a PCR test too, and also to do lateral flow tests if possible. We will contact all the parents in the impacted group by phone to discuss the situation and to discuss arrival and departure plans. For a specified period, we would be asking the children in that class to be dropped off and collected at 9:15 and 2:15 to avoid the busy arrival and departure times, and be talking with you about how possible it would be for you to bring the children to school and to collect them at the end of the day. In exceptional circumstances where that's not possible, Public Health England have advised that if they have to use a school bus, it would be best if they could wear a mask, although I appreciate that is not possible for all of our children. And we would encourage you to try, as I've said, to get them to do a daily lateral flow test. In doing this, we would hope that although we have one class impacted and doing school a bit differently, that would enable us to keep the rest of the school functioning as it has been since September, avoiding going back to full bubbles or class closures, or even going back to having children learning at home. There are other steps that we're already taking in school and other ones that we're considering that I want to explain to you too. Staff are wearing face masks in communal areas, and cleaning and hand washing continues. We continue to have increased ventilation in the rooms, and we're continuing to be reminding the children about hands, face and space, and about catching it and binning it when they're using tissues. We're considering whether or not those of the children who eat packed lunches will return to eating them in classes. We also ask that all visitors to school who are not just picking up and collecting at the end of the day and the start of the day take a lateral flow test, which they show us their negative result before coming into the school building. Any trips out are being COVID risk assessed. There will be no large scale Christmas events because we do not want to put lots of people in the same area. We ask that you absolutely do not send your child into school if they're displaying COVID symptoms, which are a temperature, a persistent cough, or a loss of taste and smell. If they develop these symptoms in school, you will need to be able to pick them up immediately. Please ensure that you have plans in place to support us in this. When a child displays symptoms in school, they are required to be isolated and their classroom is required to be cleaned. This is staff intensive, and a long wait can also be distressing for your child. If your child is poorly with other common symptoms or has sickness and diarrhoea, they also need to stay at home. I appreciate that some of our children have loose bowel movements as part of their everyday functioning, and if that is the case, we will discuss that with you and the medical professionals to work out a plan. But we are not medical professionals and will not be able to have children in school who are displaying those symptoms without that discussion. We follow Public Health England guidance when we ask you to collect your children from school if they are poorly. I appreciate it's really difficult for you when you're working. It's also really difficult to know when a child has COVID symptoms or not, but for the safety of the whole community and to ensure that we're able to keep as much of school functioning as usual, it is really important that we all play our part in this and that we do have our children at home when they're unwell. When staff are poorly, or when we have too many staff who are poorly, activities and routines in school need to change, and that can make things very difficult for the children. Equally, if we have too many staff who are poorly at once, it can become unsafe to have classes open, and then that's when class closures start to occur at the very last minute, because we don't have that information in advance. What we're trying to do is avoid this at all, as much as we possibly can, and ask that you help us within this. I do hope that by explaining this situation to you and our plans moving forward, that will help you with planning as well for yourselves. So just to reiterate, so the